Thank you for joining us for the APS Basic Skills Pre-Service webinar. I am Laura Gerganis, and I am a Program Coordinator for Adult Protective Services with the North Carolina Division of Aging and Adult Services. This presentation is a general educational experience. It is not intended as legal advice or case-specific guidance, but rather is a basic skills overview. Specific cases can be discussed with a Division of Aging and Adult Services representative upon request through the listserv. While the guidance provided during this webinar is based upon information available during its development, the accuracy of its elements are subject to change based upon updates in law, administrative code, and state policy. This presentation is intended to be viewed prior to completing the face-to-face classroom training and should not be considered a substitute for the entire Adult Protective Services training module. Welcome to pre-service. We have enhanced and expanded the training for Adult Protective Services by seeking to provide you with a baseline of knowledge before you join us for APS Basic Skills classroom training. Today begins that journey. Our goals for you within pre-service training are to, number one, establish a knowledge base for Adult Protective Services. Number two, know and learn your own agencies so that you may apply programmatic guidance. And three, prepare for APS competency training. We have structured this pre-service format to be entirely online. Pre-service consists of webinar presentations with accompanying activities. You have been provided with PowerPoints and attachments that we will use throughout the pre-service presentation. Pre-service training will count as 16 hours worth of training. Now let's talk about how pre-service is structured. Pre-service is broken up into multiple sections. Each one has been labeled in the order that it should be viewed. Everyone should have their introduction letter outlining what is due back to me after successful completion of all presentations and activities. There are 5 different components of pre-service. Each component has a presentation as well as an opportunity to practice that competency. The first component is an introduction to the policy and general statute for APS. The second section is for the ethics and principles of APS. The third section is learning the 5027, statistics for Adult Protective Services, and the demographics of Adult Protective Services. The fourth section is an introduction to the Administration for Community Living's Voluntary Consensus Guidelines for APS systems. The last section is an introduction to our state LME MCOs. There are 6 different written activities, including a policy fill in the blank, the 8 principles of APS, the know before you go, the APS record review, the ACL question and answer, and the LME MCO question and answer. Now that we have reviewed how pre-service is structured, let's examine our objectives. As we mentioned at the beginning of this training, our main objective for this pre-service presentation is for you to establish a baseline of Adult Protective Services knowledge so that you are better prepared for hands-on, competency-based classroom training. We want to define and help you understand the Adult Protective Services program. We want you to understand the ethics behind Adult Protective Services and their applicability to APS practice. In conjunction with the ethics of APS, we want you to understand the 8 basic principles or tenets that govern APS practice and guidance. We also want you to know and understand the legal base of APS, all relevant and pertinent definitions, and the applicable general statute and administrative code that governs this program. Finally, we want you to also be able to know your own agencies. We want you to identify key persons within your agency so that you may apply APS guidance appropriately, as well as having a reference point when we discuss those processes in classroom training. You will also apply your knowledge by completing a basic APS record review. This will allow you to identify key APS terminology in a real record. Now that we have covered the structure of pre-service, let's dive right into APS policy and statute. All guidance that you receive throughout training and the APS manual is rooted in general statute and administrative code. You must be able to identify key terminology as well as understand policy in order to effect appropriate services. Let's first briefly go over where Adult Protective Services comes from and a little of its history. Title 20 of the Social Security Act was made a bill in 1975. What that title did was permit states to use funding, commonly known as the Social Services Block Grant, or SSBG, for both advocacy and services to adults. Eligibility centered around adults who, as a result of physical or mental limitations, were unable to act on their own behalf, were seriously limited in the management of their affairs, were neglected or exploited, or those who lived in unsafe and hazardous conditions. It is a capped entitlement program where each state has a share according to a formula that is further specified by statute. Each state determines what services are provided, who is eligible to receive them, and how the funds are used. It is important to understand that every state across the nation handles adult protective services in some manner. The National Adult Protective Services Association, commonly known as NAPSA, is the national nonprofit organization with members in all 50 states. Their mission is to strengthen capacity of APS at the national, state, and local levels so that staff members and community members effectively and efficiently report, recognize, and respond to the needs of elders and adults with disabilities so that we prevent such abuse whenever possible. Let's look at some of the ways APS is defined across the various states. APS is defined and administered differently depending on the state or jurisdiction that you are in. Sadly, there is no federal law or mandate governing APS. Some states define their eligible population based on a type of vulnerability. Some define APS by a certain age group, for example, anyone over the age of 60, while some states define their programs by type of disability, and some states combine one or more of these definitions. Each state also defines the various types of maltreatment, such as abuse and neglect, in different manners. Now that we have looked at APS in a broad sense, let's break down APS specific to us in North Carolina. We have said multiple times the term Adult Protective Services, also abbreviated as APS. But what exactly are Adult Protective Services? Adult Protective Services are those services provided to ensure the safety and well-being of elders and adults with disabilities who are in danger of being mistreated or neglected, are unable to take care of themselves or protect themselves from harm, and have no one else to assist them. When we break down this definition a little more, we would like to highlight that the important things for you to consider as a social worker is what the definition of safety means to you. What does well-being mean to you? Take a few moments now to define for yourself what safety and well-being means as it pertains to your work. No matter how you define these terms for yourself, it is important to remember that safety and well-being is different for each and every adult and for each and every circumstance. We will continue to dive into these dynamic concepts as we proceed through training. As we move through the different policies and statutes, it is important to note that the language within the policy centers around certain definitions. It is important to understand how each term is defined as we utilize these terms all throughout APS training. North Carolina has 3 different laws and policies that govern the administration of its program. Our first law is North Carolina General Statute 108A. Within 108A, there are 3 articles that we will reference frequently. Those articles are Article 1, Article 6, and Article 6A. Our next law is the North Carolina Administrative Code 10 NCAC 71A, titled Protective Services for Adults. Lastly, we have the requirements for the provision of services manual. Let's talk about each one. North Carolina law involves General Statute 108A and its accompanying articles 1, 6, and 6A. There are many working parts to this statute, with the first and foremost to bring to your attention being that of General Statute 108A, Section 14. This states in part that the Director of Social Services shall have the following duties and responsibilities: to receive and evaluate reports of abuse, neglect, or exploitation of disabled adults, and to take appropriate action as required by Article 6, titled Protection of the Abused, Neglected, or Exploited and Disabled Adults Act. In summary, all parts of the APS process are summarized in this one part of the statute, which is DSS has the sole responsibility to receive, screen, and evaluate the need for protection in both domestic and institutional settings. DSS is the only entity that is statutorily authorized to provide protection. We will not cover every single statute in detail, but will make references to them in both pre-service and classroom training. The next policy we will talk about is North Carolina Administrative Code, commonly referred to as just Administrative Code. Codes are rules that are written to fully interpret statutes and are broken up into subchapters by program type. Rules related to protective services for adults are specifically located and enumerated as 10A NCAC 71A. It further advances the requirements which must be met by county departments of social services in carrying out their responsibilities for the protection of disabled adults under Article 6 of Chapter 108A that we mentioned on the previous slide. An essential part of administrative code that is frequently referenced is the one governing the Adult Protective Services Register, or the APSR. The administrative code is 10A NCAC 71A, Section 0806. Both general statute and administrative codes pursuant to adult protective services are located in full within the APS manual in order by number. The last policy that we will cover today is that of the requirements for the provision of services by county departments of social services. This manual is done by the Division of Aging and Adult Services. North Carolina's programs of social service consist of a variety of core and supportive service that may be provided alone or in various combinations that are best suited to the needs of the adult. The requirements located within that manual support both administrative code and general statute by ensuring that adults are protected from abuse, neglect, and exploitation, while also assisting disabled and dependent adults, ensuring they live in the most independent setting feasible with the least possible intrusion from public agencies. One of the common misconceptions within reporting requirements is the notion that there are specific subgroups that are mandated to report adult maltreatment. Unlike our Child Protective Services counterparts, the reporting requirements do not mandate certain professions or groups to report maltreatment. According to General Statute 108A, Section 102A, any person having reasonable cause to believe that a disabled adult is in need of protective services shall report such information to the director. Everyone has equal responsibility in reporting maltreatment, whether it is family, neighbors, agencies, or professionals. Of importance to the reporter and you as a possible intake social worker is that the reporters are protected or immune from civil or criminal liability. When reporting potential maltreatment, as long as the report is made without malicious intent or in bad faith. Statute 108A, Sections 102A through C further define the duty to report, the content of the report, and immunity. We will now spend some time defining some of the various terms associated with adult protective services. Being able to understand the terminology as it relates to this program is critical, as many of these terms resurface at various parts of the APS process. Within North Carolina General Statute, the definitions are located in General Statute 108A, Section 101. Within North Carolina Administrative Code, the definitions are found in 10A, NCAC, 71A, Section 0102. The crux of our entire program is based on the definition of a disabled adult. In classroom training, when we discuss intake, you will have to be able to collect information on the alleged adult and their disability. Disability is one of the main criteria we need when screening the referral. There are three parts to this definition when defining a disabled adult. First, they must be present in the state of North Carolina. Second, they must be 18 years of age or older, or an emancipated minor. Lastly, they must be physically or mentally incapacitated. Let's break down incapacitated by a disability a little further. Enough information should be gathered at intake to determine that the adult can and cannot do for themselves because of a mental or physical disability. A general description that the adult is old or senile is not adequate. Functional limitations or impact to the adult are keys to meeting disabled adult criteria. It isn't so much whether they have a certain diagnosis, but rather, if they do, how does it affect them and their ability to function? The key word in defining disabled adult is incapacitated. One person with diabetes could be incapacitated by that diagnosis, as evidenced by an inability to walk from potential diabetic neuropathy. However, another adult with diabetes may not have neuropathy and can walk adequately, therefore would potentially not be incapacitated by that disability. It is also important to understand that their capacity to make a decision is not what the definition as it pertains to disabled adults is referring to here. Disabled is not a diagnosis. We are looking to define how the disability affects the adult's ability to function on a day-to-day basis. Let's look at a few more examples. An adult had a stroke last year that now requires their help with bathing and cooking. This could be a physical disability that is impacting their activities of daily living. Maybe an adult has memory loss or a mental disability and seems confused, affecting their ability to manage their needs. Next, we will look at some of the various factors that could impact disability. As we discussed on the previous slide, there are many factors that can affect disability. Coping ability refers to someone's ability to understand the needs that they have due to their diagnosis. The adults may have financial resources to assist with caregiving or daytime activities, or an extensive social and emotional support system for their disabling condition. They may have an extremely positive attitude about their disability. We should also assess their age as it relates to their disability and how long they have had that disability. If someone has been in a wheelchair for 30 years and has figured out how to live that way, we may not necessarily say they are incapacitated since the onset was so long ago. A question you should always consider asking yourself is whether these factors change the fact that they are disabled. There are 3 different categories of maltreatment in North Carolina. The first one we will cover is abuse. Abuse is the willful infliction by a caretaker of physical pain, injury, or psychological harm, mental anguish, unreasonable confinement, or the willful deprivation of goods and services that are necessary to meet essential needs or avoid physical and psychological harm. We will define the term caretaker on the next slide, but there must be a caretaker involved for abuse to be considered. Physical or mental harm by other individuals could be considered for neglect or even criminal categories such as assault. A key term in this definition is willful or intentional. Let's go through a few examples of willful infliction of pain. Withholding medication to an adult who needs them. Restraining or confining an adult to their bed so that they cannot move, resulting in ligature marks on the wrist. Locking an adult in their bedroom with a padlock is also considered unreasonable confinement. Many times we hear that families state their loved one's dementia is so bad that they are wandering out of the house. They therefore state, in order to keep them safe, that they're locking them in. However, this is also considered unreasonable confinement and families should be educated accordingly. Since abuse must be by a caretaker, let's define that next. The definition of caretaker is dynamic with many layers. A caretaker is an individual who has comprehensive responsibility for care of the disabled adult as a result of family relationship, or who has assumed responsibility for the care of that adult voluntarily or by contract. The key term within this definition is comprehensive. A caretaker must be responsible for meeting all of the adult's basic needs. It could be a family, friend, or neighbor that has informally assumed or been given those day-to-day responsibilities. A caretaker is also the operator or their representative of a nursing or residential care facility, but does not involve individuals or organizations that provide specific, time-limited services such as in-home aides. The next category of maltreatment is neglect. Neglect refers to a disabled adult that is either living alone and not able to provide for himself or herself the services which are necessary to maintain the person's mental or physical health, or is not receiving those services from his or her caretaker. We break this into 2 different categories. Self-neglect is when a person does not obtain for themselves essential food, clothing, shelter, medical care, services for physical and mental health, or manage their financial affairs. Caretaker neglect is the failure of a fiduciary, caretaker, guardian, or power of attorney to provide or obtain those goods and services necessary to maintain the health and safety of the adult. The last category of maltreatment that we will define is exploitation. Exploitation is the fraudulent or otherwise illegal, unauthorized, or improper act or process of an individual, including a caregiver or fiduciary, that uses the resources of a disabled adult for monetary or personal benefit, profit, gain, or one that results in depriving a disabled adult of rightful access to or use of their benefits, resources, belongings, or assets. Exploitation does not have to be by a caretaker to meet the statutory definition. Let's break down exploitation a little more. Exploitation can be of the person or of their assets. Exploitation of the person includes sexual exploitation and trafficking or forcing a disabled adult to work with unfair or no pay. With exploitation, it is important to remember that the definition includes illegal or improper use. Just because an adult's basic needs are being met does not mean they aren't exploited. Any use of the disabled adult's assets for someone else's benefit is exploitation. Improperly using someone's assets or finances can include property deeded or willed improperly, misuse of a power of attorney, such as signatures obtained through undue influence or coercion, the theft, sale, or misuse of medications, or the use of public benefits cards such as food stamps, or the illegal use of debit and credit cards. When determining whether we evaluate a disabled adult, we must be able to define what is meant by in need of protective services. This means that a person, due to their physical or mental incapacity, is unable to perform or obtain for himself essential services, and that the person is also without able, willing, or responsible persons to also obtain those essential services. We break down this definition even more during classroom training when screening a report in or out. The last definition that we will cover today is essential services. Essential services are all social, medical, psychiatric, psychological, or legal services necessary to safeguard the adult's rights and resources and to maintain the physical or mental well-being of the individual. Essential services include, but aren't limited to, the provision of medical care for physical and mental health needs, assistance in personal hygiene, food, clothing, adequately heated and ventilated shelter, protection from health and safety hazards, protection from physical maltreatment, and protection from exploitation. In summary, it is essential to have a baseline level of knowledge for both our policies and what these terms mean as we move through the different competencies in APS. All of these terms are used throughout statute, administrative code, and the social work guidance that is provided during training. We will now end this component of the pre-service presentation for you to practice finding policy and statute within the manual and locating your key terms. Please refer to Handout A in your pre-service materials. Handout A is the activity Policy Fill in the Blank. Please ensure that you use General Statute 108A and Administrative Code, both located within the APS manual, to complete the activity prior to moving to Section 2 of pre-service. Thank you.